Hello, thank you. It's really brilliant to be here, and thank you for asking me to present today. So I just want to be really clear that the panel made a difference in the review that has taken place. So the BAME VSE panel made a difference, and I'm going to describe how we made a difference and some of the ways that that difference is permeated through the review report. So next slide. Reality check. So first and foremost, we were really clear that the ICS review needed to acknowledge that racism exists and white privilege exists. And without those two things being acknowledged, it was not possible, A, for us to be involved, but also for this review to come to the conclusions that it has. Health inequalities are linked to the behaviours of people, which lead to people like my dad, who's from the Caribbean, people from Black South Asian communities across West Yorkshire and Harrogate. Their health inequalities have been affected by racism, and we wanted that to be absolutely acknowledged. But also, we wanted it to be acknowledged that white privilege in the system was one of the barriers to Black people's career progression, and also to an understanding as to why Black people's health inequalities were worst. So that was something that we wanted to be really clear about, because the current lens, as we got there, the lens was very white and was very Eurocentric. That's the difference we made from day one. And we also wanted to be clear that BAME, it's used throughout the report. It's important to recognise that the report also refers to the BAME over piece of work that Inc Arts have done, which is all about using the right language to describe people of Black, African, Caribbean and Southeast Asian heritage. And the report does refer to that piece of work, which we're really pleased about. But more importantly, we're all different. So all white people are different and all Black people, Southeast Asian people are different. But the thing that Black, Southeast Asian people experience that is the same is racism. Indirect, direct, microaggressions, you name it, we experience it. And it has an impact on our health, physically, mentally, and on our opportunities. As a result of those experiences, we were also sceptical. So we wanted the review panel to understand that we've been here before. Black people are being asked over and over again to take part in reviews, evaluations, fill this form in, give us your feedback, and nothing ever changes. So we were really sceptical about what would be different, and it took some time to build up a level of trust. But because the review panel was so, I think keen's the wrong word, but they were so open to hearing our reflections and so open to accepting their white privilege, that began to build that trust, and it built very quickly. And we also wanted an opportunity to celebrate the contributions of the Black Southeast Asian VCS across West Yorkshire and Harrogate. And that was another element of our contribution that we were keen to promote. It's great to see that today on the West Yorkshire and Harrogate website, you will see our insight report, which is a work in progress. We haven't finished it yet. We've still got lots and lots of brilliant examples of fabulous contributions that we make to the health and well-being of our communities, but it's there today, so please do have a look. And we've also done a podcast that has members of the panel, and some of them are here today. Thank you so much for coming. And we're talking about both our lived experience of racism as individuals, but also the work that we're doing across West Yorkshire and Harrogate with communities, and how this work of the review will hopefully impact positively on the lives of those communities. So on to the next slide, looking at the areas of deep dive that were undertaken, we think we made a difference in the following areas. So I've lumped together recruitment and leadership because actually they are linked. And the challenge we brought to the review is that it was all about Black people being ready, being trained, and our challenge back was, well, we are here, we are ready, we are good enough, and you need to come and get us. So you need to find ways to in-reach into your own workforces because the talent is there, but also outreach into the communities that we're in, that our communities are in, faith sectors. We are there, we are ready, you need to come and get us. So that was a very clear challenge, and we were really pleased to see the fellowship programme fall out of that challenge that we brought. We're also really clear that the disciplinary and grievance figures in NHS trusts across the piece needed to be addressed, and we also challenged the team on collection of data, all of which have been included in the report. But more importantly, we demanded action. We don't just want people to see analysis, review, such as the equality impact assessment that has been going on for years and years and years. Nothing happens as a result of those. So our challenge was, yes, do the data, yes, do the analysis, but act. And that's where we put that challenge in. And in fact, what we're saying is we're going to be here throughout the whole of the action planning and the delivery of these recommendations, because we want to see that action and we want to be part of holding the system to account. On the population planning, I was delighted when I read the report because I could see things that we had actually said replicated in that report, and that gave us power, that gave us validation, that made us feel that our time freely given had been worth that investment. So the 100% ethnicity recording came from us, and we celebrated in seeing that in the report. But we also really strongly said that the new system that comes out of this for commissioning needs to commission for health inequalities in the areas where the poorest people live, because that's where Black and South East Asian people live too. So we need to see a contract being developed between commissioners and the communities that they serve that understands the importance of the small BME, VCS organisations, the faith-based organisations that are already operating in those areas. We need the commissioning structures to understand the importance of the existing BME, VCS organisations, but also faith-based organisations, because we were really clear when we talked about the wider determinants under the health inequalities and mental health, that Islamophobia is a major issue in West Yorkshire in particular, maybe less so in Harrogate, but in West Yorkshire it's a major issue in health inequalities, and it needed to be addressed alongside racism. We also wanted to see some micro commissioning for very small VCSC organisations within the report, and again that is in there. So in the inequalities in mental health, we raised wider determinants many times, and we were really pleased that the role and the power of the voluntary community sector and the communities we serve, that power was acknowledged in that report, because we have the ability to work with the system to deliver the outcomes that are being proposed. So in lots and lots of different ways, we could see the difference that we made. We are committed to ensuring that this work is delivered. As I say, we want to stay. We want to work with the system to make sure that the action plan, which we're working on too, is delivered. And we want to work with you, hold you accountable, because we've invested our time, our passion, our energy, and we've done that for the communities we serve. So we're not going anywhere. We've made them promises, and we're going to hold you to account. Thank you.